Hello, everyone. Welcome to the webinar of SwiCell. I'm just going to shortly introduce myself before I start the presentation. I hope you can see what I can see here on my desktop. No? So today I'm going to talk about the combination procedures with the cell boosters. Just a quick presentation of my person. So who am I? My name is Timur Taskesen. I'm a dermatologist and dermatosurgeon based in my own praxis in Zurich, Switzerland. And today I want to talk to you about a combination, like a recipe for skin rejuvenation, where you can use the Cell Booster line to have really good results with different kind of aesthetic and cosmetic procedures. And I will just delve into the content of today's webinar. So I will talk about different kind of recipes, how you can up your game by using the Cell Booster range to achieve different kind of results with all these products I showed you here on the content part. If you should have any questions during the webinar, please raise them in the Q&A section so that we can later on discuss them, and then we can also talk about your questions. I created this kind of cookbook style presentation because I thought it would be a little bit easier, and it's a little bit different than maybe what you saw until now, because I feel like creating a perfect recipe for skin rejuvenation is just like creating a good recipe maybe for a soup or maybe for a nice cake. And so I like to cook myself a lot, and so it's just like really easy. And everywhere I go, in every country I go, I always visit the supermarkets to see what's there in stock, what they have in mind, or what they just offer. And so I sometimes create a different kind of recipe for maybe a well-known thing I was already using. So let's delve into these recipes and uncover the secret ingredients to make them a feast for the skin. So, Cell Booster. What I would just want to talk about a little bit is just like about the specialty of the SwiCell product. SwiCell is a Swiss-based company, and Cell Booster is one of the products that I really like from this company. What makes it so special? The specialty is about the CHAC technology. CHAC is something that stands for cross-linked hyaluronic acid complex. The really innovative form of this is just like here. I show it to you in a little bit easier steps so that it's just like easier to follow. The major steps in this CHAC technology in detail is just like that they are formed in solid phase. So meaning that we have the high molecular weight HA matrix that we mix with the vitamins, the amino acids, the oligoamide elements, and then by using shear deformation, by using pressure and heat and time to open up the helix of the hyaluronic acid to enclose the ingredients and to have a better effect then by using this kind of method to have a better bounding between the HA and the vitamins and the amino acids, but not using any kind of chemical binding agents. And so this is the perfect recipe to be able to bring the oligoelements, the amino acids, the vitamins into a deeper level of the skin, and by thus just having better effects than any kind of mesotherapeutic option that we have at least now on the market. So the advantages are just like mainly that the HA is like a perfect vehicle. So I usually call it like a taxi or a cab, just like a bus, bringing the good ingredients inside of the skin, and by that helping to bring structural and biological benefits to the skin. And also by having the HA as a vehicle, you can just transport a lot of these kind of amino acids, vitamins, and nutrients within the skin, and so to have like better results. I will later show you also that we have just like 4 products, and 4 products are having just like different kind of effects on the skin, and so that we can talk about that later on as well. The effects and the definite benefits of the product in comparison to maybe normal HA fillers are different, because they are just like 4 different cell booster types, which are just consistent of selected vitamins, amino acids, and of the oligo elements. And so by this, you have just like an enhanced stimulation of the thing that you want to stimulate. So with the Shape, for example, you can target the adipocytes and the lymphatic system by having a better drainage, by reducing the fat by a different kind of way, by even burning the fat in the inside of the mitochondrial areas. The Lift, for example, is activating the fibroblasts, and by this also having a better hydration effect and microcirculation. The Glow is more just like for the pigmentation, attacking then the melanocytes and having this like an effect on the melanogenesis in different kind of ways. And the Hair product is something to nourish the hair follicle and the scalp. And so they are able to work within the skin and also rejuvenate the skin in a different kind of way, other than maybe just HA alone can do. And so what is definitely beneficial and interesting is the combination of these. But I will show you that there are a lot of combinations possible with this kind of cookbook idea that I just developed. And then you can see that there's a lot more possible than what we can do. Still, if you have any kind of questions, please put it in the Q&A section, and then we can talk about it later on. And by having different kind of products on the market, which makes it really interesting to see what's possible also in the combination. So not one product will bring the benefit. So sometimes it's the combination, and sometimes it's also nice to see what we can bring out of that. And I will show you that by delving now into the theme of this webinar. So what is the main agenda today is to show you how I do it. And so sometimes it's also something that you already do yourself. Maybe sometimes it's just like within any kind of recipe, it helps to maybe see the kind of following, what to do first and what to do next. Sometimes it changes the recipe in a total different way. And sometimes it's also interesting to see what is possible. And so this is really a good thing. But in a great way, it's always best to have the combination done. And the Cell Booster is a product which benefits like for everybody. And so we'll just have like a really nice skin by using these kind of ingredients. So as I told you, for cell boosters today, I will just focus mainly on the injectables of the face, so Lift, Glow, and Shape, and I won't talk too much about the hair today. The Lift has performed really strongly, and this is also just like showing in the clinical trial that has been published. And so to see what is having the effect is just like primarily the skin microcirculation, the viscoelasticity, and the skin density that is going up with this kind of products. And it's so easy to administer, and it's so safe. And this is definitely a good additional cocktail for your practice. So let's delve into the anatomy, because you know, every trainer is talking about the layers of the face and also where to inject and what. And you'll definitely see these kind of recurring slides on the upcoming recipes. And so the important thing is that if we are talking about different kind of layers, they are just like 5 to 6 layers of the face: the skin, the subcutaneous fat tissue, the muscular aponeurotic system, the retaining ligaments, the deep fascia, the periosteum, and the superosteal parts and the bone. This is really important where to inject it, and I will also talk about that later. And this is just like another kind of way how to demonstrate where I will inject and what to inject. And you will see that also on the slides, that there is a small marking about the product which is injected, and also in the layers which are just like really responsible then for the change of the skin. And I will also provide you with some pictures of my patients so that you can know where and how it developed. So let's delve into the first recipe. So hyaluronic hydration. Hyaluronic hydration is for me just like a perfect addition, as I told you before, to add the hyaluronic acid and the like any kind of filler with the cell booster, and also just like putting it then on a different kind of level makes it easier to have different kinds of effect. And so sometimes you think, okay, a cell booster is already containing hyaluronic acid, so why do I need another hyaluronic acid? But the problem thing is, it's really important to also have in mind that that the cell boosters don't have any kind of G prime. And so if you want to have a volumizing effect, you need to use any fillers. And by that, it's just like definitely also important to know where to inject what. And so here is one of the slides I already talked to you about. So if you want to inject the filler and you want to have a volumizing effect, you want to have a smoothing effect, you need to go deeper inside of the skin to do that. And by stretching that that area, or by filling that area, you will have a definitely better effect. So you can go down to the bone, you can go into subcutaneous tissue to fill up any kind of wrinkles. If you want to stretch the fibroblasts, you can put them into the stratum reticularis, so in the deeper part of the dermis, and so you will have better results. If you want to put the cell booster then on top of that, so you can do that by staying in an intraepidermal way. You can stay in an intradermal way. You can also put them into the dermal areas, and so you'll have a different kind of effect by adding up on top of that. And so it's just like different kind of layers of a cake. So what's really important is that always just like ensure that the skin is properly cleansed and prepped. Then first I start by injecting the cell booster. This is just like a base for the hydration recipe. So it revitalizes the skin, it helps to smooth the skin, and also helps to integrate the HA, the filler, for the next step. And then you can just see where you want to add a filler, and you can go deeper, down low, and then you will have a different kind of effect. And by that, you will also have less downtime for the patient. What you really need to know is just like the anatomy, so where to put what, and also to avoid any kind of blood vessels. This is really the most important thing. Here, for example, I can show you where I did what I did. So you can see on the left part, this woman where I injected the lips, where I injected the zygomatic bones, where I injected also a little bit like on the chin area, and also the lips. And you can see that her skin is also brighter and better. And this is not the effect of the hyaluronic acid I injected there as a filler. This is mainly the effect of the cell booster glow. So you can see the redness has resolved, the pigmentation is better, and even the relief of the skin is different because it shines differently. And also the same part on the picture with the other model I injected. So where you can see that we injected the jawline to make it a little bit more smoother, and superficially I injected in an area of concern, for example, the Cellbooster Shape, to reduce any kind of puffiness and swelling, but also to reduce because of the stretching, you will also have a better effect because of the double chin area. And then I also injected in that area the Cellbooster Shape to have a better shaping effect, undergoing also the same areas of treatment as I did with the HA filler. So the next recipe I'm going to show you is the PLLA recipe. So this is just like PLLA is a polylactic acid. Polylactic acid is something that is quite common at the moment, and that a lot of people are using that. And it's just like they're named as the elixir of collagen. And this is just like the biostimulators that are on the market. And there are a lot of biostimulators on the market. And I feel like this is just like something that is really interesting also to combine with a cell booster, because biostimulation is taking place in the deeper parts of the skin, by thus meaning that we need to inject deep dermal in the subcutaneous fat tissue, so to have a better effect of the distribution of that product. And by PLLA, for example, it's possible to use, for example, Sculptra, Landuma, or whatever is just possibly available in your countries. And then you can just add on top the cell booster by having a really nice effect, and also by having an adjunctive in the way how it works and how it will just have an effect. Again, here's just like a step-by-step instruction to create this kind of elixir. And what I do is that I always layer first with the by using, for example, the PLLA, by going deeper inside of the skin and having just like attack then the subcutaneous fat tissue and the deep dermal parts. And then afterwards, I layer it on top with a cell booster to amplify this kind of collagen boosting effect, because the problem with the PLLA is it's mixed with sterile water, and sterile water is dissolved. It dissolves over time, is put out by the lymphatic drainage system, and then the first effect of this volumizing effect is gone, and most people are just like a little bit disappointed after this kind of thing just happens. And this is what I developed, that I thought, okay, why not layer it then with Cell Booster, because then you already have a little bit of a hyaluronic acid that is inside, and it will boost an effect, showing an effect just like immediately, and also by boosting the effects of the collagen in a different kind of way. And here you can use, for example, the Cellbooster Shape to having a better lymphatic drainage because of the free water that will resolve, but also using the Cellbooster Lift, for example, to having a better effect by having this kind of enhancement for overall texture of the skin. This is really a nice way to complement this therapy, and this is definitely a nice way to do that in unified options. The thing is, with the collagen induction, it takes some time. And so what I would do just in between would be just like I start by injecting, for example, the PLLA, naming here, for example, Sculptra, and then I will layer it with a cell booster, and then I will wait. I will see the patient maybe 1 month later, and then I will inject the cell booster in the short time in between, because then we'll have a nice effect for the glowy skin, we'll have a nice effect for the induction period, because the collagen growth takes time, and until 8 or 12 weeks are over, you won't see anything much of the Sculptra effect, and later on you will see that as well. And by having this, you will boost the total effect of that both together. So here, for example, I can show you some pictures where I did this combination on a patient, and you can see her skin was a little bit dull. She was a smoker before, and so you can see these small fine lines around her mouth, and you can also see the pronounced jowling, and also the kind of loss of glowiness of her face. And then you can see her 2 months after, and you can see that her skin looks brighter. Her skin looks a little bit more well-textured, and this is really a nice way so that we could just deal with that. She was a patient of mine where she only came in to do the nasolabial fold and to do the toxin. And after I showed her the possibility of having a different kind of skin texture by using a biostimulator, she was onto it. And so that's why we did this kind of perfect combination therapy. Here you can see the administration of the Sculptra in the deeper parts, which I always do with the cannula. You can use a big gauge cannula, like 22 gauge would be okay, even 19 gauge, 20 gauge, 21 gauge, depending also on the producers, is possible, so that you go deep inside of the skin and administer the product really in the deep dermal and also in the subcutaneous fat tissue, so that you are sure that you just are not too superficial. And later on, you can layer that by using the Cell Booster Lift, for example, to have this really nice complexion. And then you can just do that either in the same manner by going a little bit more superficial with the fanning technique, or you can also administer it by injecting them just into the skin. So here you can see also these nice results, and I feel that it's just like a really nice refreshed version of herself. And this is really something which I really liked about these products, because it's just like a natural way of look. And she didn't want to have any kind of filling procedures done, because she was afraid it should look artificial. and I really like the results, and I really like Sculptra. And so by combining this with the Cellbooster Lift, this is giving us a really perfect combination therapy and having just like really great results, because what the Sculptra is missing is just like a direct effect. And this is really nice if we can get that by using a really safe product like the Cellbooster. Always think about just if you ever inject PLLA, for example, to inject it really deep. And by having this kind of mode of action, by inducing the collagenesis, it's really important also to sometimes help that a little bit and to plump up the skin by using something like the Cellbooster. So next recipe in line is just like the hydroxylapatite revival. So calcium hydroxylapatite is something that is also really common in use. And for example, Radiesse is, I think, the most known calcium hydroxylapatite that we use here on the market. And it's just like known as the elixir of volume. So it's just like it's a dermal filler composed of calcium hydroxylapatite. And this is just like something which is unique because it's really compatible with the skin, and also ideal for rejuvenation and for really sharp lines if you want to create this kind of look. Again, injected really, really deep and know in which plane you are. So that's why I'm always showing these kind of slides that you know that we are just injecting it in the same plane as we did, for example, with the PLLA, with the Sculptra. So make sure that you inject it in the subcutaneous fat tissue, and also just like in the, if you want and if it's possible, so in the deep dermal areas, but mainly just put it on the superficial the subcutaneous tissue, and try to avoid any kind of superficial injection. Here I will show you a slide of my patient, a male patient, which I injected. Radiesse is really common with males because sometimes they want this kind of masculinization. And if they want like a broader face, if they want a sharp texture, it's really nice to use this product. And sometimes what it's missing again in this product is just like that you want to have a different kind of effect. What's really important in this kind of thing is just that Radiesse is missing a hyaluronic acid component. I know that a lot of people are just like injecting it by mixing it also with the hyaluronic acid, which I don't really like, because then it loses for me the shaping possibility. And so when I dilute it, I do it like 1:1, and then I really can use it by having this really nice effect. And then I layer it later on top with the Cellbooster by having an enhancing effect then, and also having a nice effect on the skin rejuvenation. By blending, I mean just like some sort of slight massage, and then you will need to wait. Here, for example, you can see that this gentleman came for mainly masculinization project. So this was done by me a few months ago. And what's really, really important is that it takes time, and sometimes you have to just adapt a little bit of the steps. What he was missing were these sharp features of his face. So he wanted a little bit more like a square chin. He wanted more just like a pronounced jawline, and he was missing also this a kind of mandibular arc. And so that's what we try to establish then here. And here you can see, for example, the treatment in the middle, where you can see that that after injecting the Radiesse in these parts where we just wanted to have a nicer effect and a nicer angle, I also used a little bit of a filler to fill out his mid-face volume loss. And then I layered that later on with a sprinkle of hyaluronic acid in combination of the Cellbooster Lift. Here you can see it 1 month after, where I wanted to see the patient again. And to be honest, I was a little bit disappointed in what I had achieved, because if we go back, then you can see how it was just like in the middle of the treatment, and it looks really looked really promising, and I felt like, wow, this is just like a wow effect. A month later, I was a little bit disappointed in my treatment. Even though I could see the nice chin projection and also the nice jawline, I was missing a little bit like the skin texture improvement. And as you can see also in the pictures, he still has these kind of small marks. The skin still looks a little bit dull, and still the redness is just still visible. And I felt like, okay, let's layer that with another cell booster lift, and then wait. And then wait is sometimes is something which really makes it hard for us doctors to do, but it was worth the wait, because 2 months later, you can see how bright his skin is now, how evolved everything is looking, and how just integrated everything is fine. And now you can see in the pictures, even the skin brightness has changed. And what I would really emphasize on is that even that you can hardly see any kind of marks anymore. And it's really nice that his complete complexion has undergrown. And it's really nice that it's something that it's really good for use. And this is mainly the effect of the cell booster. But the Radiesse and the filler also helped to have a more chiseled look. So again, think about the injection depth if you use Radiesse or calcium hydroxylapatite. So this is really the important thing. And by mixing this with the cell booster, you can see that it has really nice effects. And these are just like the vectors of the face where I use it manually and mainly. So HarmonyCa. HarmonyCa might be something that you also know. HarmonyCa is just like the combination of the calcium hydroxylapatite and the hyaluronic acid. This makes it a unique fusion. No? And so why do you think would add hyaluronic acid on top of that if it already has a hyaluronic acid? And this blend is nice, but it's always also about the deep volumization. And then you forget about the skin quality on top. And so it's always beneficial to use that in combination. And by combining these two, you also get really nice results. Here, for example, one of my beautiful patients, she wanted to have her skin a little bit lifted, but she was also aiming for some kind of skin treatments. I wanted to do the fractional laser with her, but she refused, and so I was only able to talk her into these kind of biostimulators. So by combining Cellbooster with HarmonyCa is just like fusing the capabilities of both of them. And by having the hydration of the hyaluronic acid in the deep parts, which is already delivered in the HarmonyCa because of the mixture. And then by using the improvement of having the cell booster injected then superficially on top of that. And this blend works just harmoniously to provide really improvements of the skin volume and also of the firmness, and thus just having also then a better skin quality. Here you can see the pictures of this patient, and here you can see before and right after. And here you can see also that you already see that we filled up the mid-face area. We also went into her temples a little bit, and also around the zygomatic arc, and also here on the sides in the area of preauricular region. And so this is just like, for me, I will always call them the lifting vectors, because then you'll just have a nice effect. And by retracting these kind of ligaments, you will also have a nicer complexion and also like a nicer overall result. And by adding then the cell booster on top, you will have really nice results in total. Again, just a small reminder, as I told you, you will see these slides every so often after each kind of recipe by reminding you of the depth and also like on the effect on the tissue. And so HarmonyCa as also Radiesse and also as like PLLA are just like collagen stimulators, biostimulators, and by this inducting like a mechanical stretching of the fibroblasts. And this is just like having a kind of support for the whole fibroblast system. And to build up collagen takes time. So if we are just thinking about using something more energetic, and so that's why we are going now into the energy-based devices. So my recipes here are just like for lasers, for microneedling, or even for microneedling radiofrequency, or for radiofrequency or ultrasound, focus ultrasound alone. So before we craft this kind of energy elixir, let's understand the ingredients. So energy-based devices include the ones I already talked about. And these treatments are known for their role in the skin enhancement and also having just like really unique benefits to rejuvenation of the skin. But adding the cell booster on top of that is just like having a really nice effect. So it's just like adding a cherry on the top of a cake, or adding a little bit of a spice onto a soup, or so to have a really nice effect, and also by changing the whole idea behind it. And so what I really like to show you later on as well is just like that I use it even with a laser enhancement and do it even in the same session. And this is really important. I will tell you how I do it and also how to do that in your clinic. And so it's really an enhancement then for the overall options that you can use. Microneedling is something I standalone do seldomly, but it's perfectly fine if you want to stimulate the collagen production, and it definitely has a nice effect. You can use a cell booster either topically, but as a class 3 device, it's always better to use it by injecting it, because then it's so much more potent. Radiofrequency is something where you can also stimulate the collagen, and by tightening the skin for having a better effect, and by having not to wait until you see a kind of radiance, you can always add the cell booster then on top of that, and then you will see that you will have really nice effects afterwards. And so I will just dive in, and so into the fractional CO2 feast. So the next recipe for you. So the fractional CO2 feast is just like cooking up beauty, because you know fractional CO2 laser burns the superficial layers of the skin, and by creating some microchannels going inside of the skin. And this is really, really important, because the laser is just like a really, really high-end kitchen robot, and it creates these micro injuries and to enhance the skin texture and also promote the collagen production. And so you have to know when and where to do the injections of the cell booster. So the main thing is that with the fractional CO2 laser, we can go into a deep dermal part. And so by having a really full rejuvenation of the skin texture, and also removing any kind of superficial layers of the skin, but also having a nice effect on the harmony of the face. So by having this said, the next recipe, and maybe you'll notice, this is a picture of me after having done my CO2 laser treatment. And so this is just like really nice, because the skin feels tighter and firmer after doing that. But you have to be a little bit careful when to use, for example, your secret sauce, meaning then in this way of thinking the cell booster, because you need to wait until the skin has cooled down a little bit, because the heat is just like really something that might destroy then the effect of the cell booster. So you can use a cell booster, for example, instead of PRP or plasma, which a lot of surgeons or dermatologists like to do, so to have a faster recovery. But by using the cell booster is something that is really having the same effect and same benefits as the PRP does. So faster recovery, the hyaluronic boost, and also the reduced pigmentation after laser with the glow. And this is what I did on my own. So after having the fractional skin resurfacing done on my face, I waited, and then I had injections done to reduce any kind of hyperpigmentation, to reduce any kind of problems in the wound healing, and also by having just like definitely providing then nice results by the hyaluronic acid and also by the binding combination of the glow, by having vitamin C and glutathione as well inside to not develop any kind of post-inflammatory pigmentation. And this was really a nice way to also heal faster. And in between the pictures are just like about 5 days. So from first the laser to this, it took 10 days. And this is really nice results. So after this kind of time, you are able to go to work again. I did much earlier than that, but my patients are used to that. I'm trying these kind of different things out. So as I told you, please put your questions into the Q&A sections. We will try to go on that later on. So let's go on with the IPL. I know IPL is a laser that is also broadly used, and I like the IPL a lot because of its balancing agents in its skin tone, and also by reducing any kind of erythema, by having a really good effects on the pigmentation of the face, and also by having just like different kind of irregularities and redness, and also by the photo rejuvenation effect it does also have a nice effect on the collagenesis. So by adding this then with a cell booster, you will have definitely really nice results. And having this set, I will just show you pictures of my recipe. So what I do is that after I perform, for example, the IPL, I add the cell booster, mainly the cell booster glow, because the cell booster glow has nice capacities of reducing pigmentation erythema, and also having just like a really nice effect of tightening the skin. And by the hyaluronic acid, you have just like a replenished skin. And so you will see the effects within just the first 2 weeks. So the patients are really happy about the results of the cell booster, and the laser kicks in a little bit later, and then you will have a really nice complexion, and this is really done perfectly fine. And this will end up in achieving a really balanced skin tone, and also just like improved skin texture and tightening after this kind of procedure. So this is just like what I call my post-IPL glow, by adding a little bit dash of a cell booster glow, and by enhancing then the skin texture, the tightening of the skin, and having just like a radiant complexion within really soon. So this is something which I like to do really, really a lot. The Morpheus8 or any kind of radiofrequency microneedling device is something that is at the moment a go-to treatment. And this is, I think, also a perfect fusion for this kind of treatment, because Morpheus8 or any kind of radiofrequency microneedling device and the cell booster is something that blends in perfectly fine to rejuvenate your skin. Again, think about the depth where you want to go, because the Morpheus8 is working with fine or thin needles, and then going inside of the dermal areas. You can also go deeper if you want to attack the fat areas, but not in the face. Mainly, it's just like for the body. In the face areas, you can also attack the sub chin areas here in that area, where we call it usually the double chin area. So to have a tightening effect and also to attack the adipocytes. What's really important then is just like to wait before you inject the cell booster, because it's really important that you wait and let the tissue cool down to have a really nice effect, and also to reduce reduce any kind of side effects afterwards. What's really important is that you have to decide what you want to achieve, because if you want to use lift for tissue recovery, it's perfect, and for a lifting effect. If you want to use shape, for example, from the cell booster range line, then it's better to reduce any fat tissue and also to activate the lymphatic drainage. And I will also show you where I use, for example, what. So the combination of microneedling and radiofrequency followed by the injection of shape, for example, after a cooling phase is just like perfectly fine. And this works also very good and also having really nice results. Here you can see, for example, the performance of the Morpheus at the love handles with a male patient. And here I did a broad area in the love handles area on the back. And then I use, for example, the Morpheus body, and the Morpheus body means that we go in like for 7 millimeters. 7 millimeter depth is really high, and then we use the radio frequency by energizing that. And if we use more energy, we'll also attack more the fat tissues. And then we need to wait because the heat is just like enclosed in this area, and then we need to have a nice effect. And to have this kind of effect, we just want that so that if we use the shape, for example, we want to activate the lymphatic drainage and also just like attacking the adipocytes that are just already undergoing this kind of heat. But the heat is also a problem for the cell booster because otherwise the hyaluronic acid will deteriorate. So we need to wait. And you can measure that by using a temperature, and then you can a temperature device. And then if you know that you are just like under that the cooling phase has gone down, then you can just inject it in these areas. Also for the double chin is perfect, and also for the face, I would use, for example, the Cellbooster lift to have a really nice effect and more lifting effect. And for the double chin area, I would just mainly go for the Cellbooster shape to reduce also this kind of swelling. So next recipe, the ultrasound symphony. Many of you might use also like a focus ultrasound, for example, the Ultherapy, to combine then together with the cell booster. It's just really nice way to have a really nice effect, because the problem as also with the other things is just like sometimes with the ultrasound is that you don't see any kind of result, and sometimes the patients have to wait long time to see good effects. And by having said that, it's sometimes also cry out for any kind of therapy that has just like a really nice way to combine it. Combination is always just like, as you see, today's topic. And so combination of these two is also something that works really nice and harmonic. So you first begin, for example, the symphony by starting with the focus ultrasound, penetrating really deep into the tissue, tightening it. And then you'll wait a little bit, let the tissue cool down, and then you, depending on what you want to achieve, you use same as I did, for example, with the microneedling radiofrequency device, lift for the tissue recovery and also for plumbing up the skin and having a lifting effect, or the shape to reduce any kind of fat tissue and to activate the lymphatic drainage. So next recipe. Thread lift tonic. Thread lifts is something which I'm using at the moment again more frequently than I did maybe a few years before. It's just like sometimes I don't believe in threads, but if you find the good threads, you will see that you will have also a nice lifting effect. For example, again with a lot of jowling, and if the faces are really heavy and the people don't want like a facelift, even though it would make sense, sometimes this is maybe a go-to option. It's again not about the lift capacity of the threads. It's more just like activating again the collagenesis, and by activating the collagenesis, it's always it comes to mind that we also can use the cell booster to have a really nice effect. Here again, the threads are put just like deep inside of the skin. Again, we need to know where we are, and so this is really important. So if you use the threads, you can also use superficial threads and then combine it with a cell booster. That's also fine. But by using then threads like with hooks to have a better effect and also retraction, it's better to know that to put them really deep inside of the tissue. And by combining, for example, that I start by using, for example, the Cellbooster before I do the thread lifting, because this is really important, because you need to anesthetize sometimes with different kind of threads. You need to anesthetize the areas, and if I anesthetize, I mix it, for example, with a Cellbooster lift, and then if I go in these areas where I want to put the threads, I already use it for like a wet dissection of the tissue. And by having this already in there, first I have a lidocaine that facilitates the thread insertion, and then on the second base, it's just like perfect, because I already have something put in there that is stretching the fibrocytes, that is helping by recovering faster, and also by having just like a gentle kind of remodulation of the skin, and by this also having like a better effect on the sagging skin. And then I insert the threads, and so having just like really nice effects. Here you can see, for example, a double needle thread lift, where I have just like a better kind of options, and you can see these small bulbs there as well, where we can retract it a little bit, but I never retract it like fully, because I don't want this kind of phases, and usually the effect of that is mainly on the neochalagenesis, and that is going on, and not mainly on the pulling and on the effect of that. So if you have that in mind, you can perfectly use the Cellbooster to facilitate your way of working, and this is really beneficial, and this is really helpful for us all. So we are already, sorry, at the end of my cookbook secret ingredients. And so these were just like in a fast way going through the different kind of options where we can add this kind of therapy to have a really symphony in a way. And each ingredient contributes to the flavors of that, no? And by having just like a skin revitalization, it's just like really nice to have that in mind. If you use one of these kind of ingredients, always think about just adding a little bit of Cellbooster inside of that dash, because it's so much more potential in there that you can just maybe fuel that. And this is really nice to have a really good idea. And this is why I just also put that in the middle around these kind of energy-based devices, but also injectables, to have a really nice effect and to see what we can do about that. So again, if you have any questions, I'm happy to answer them. And so now we are just like at the end of our presentation, and this is just really important that you just like think about this kind of ideas that you can mainly use also for that. And I'm really thankful for your attention, and I'm happy if you get some kind of ideas, and I encourage you to explore and create your own skin culinary adventures with these exquisite ingredients. And then I will just say thank you very much for your attention. And if you have any questions, please let me know, and follow us for more.
Thank you very much, Dr. Taskesen. That was an absolutely fantastic talk and webinar. There's few questions actually which I was not able to answer, because it's more technical answers on the Q&A.
Yes.
So maybe you can have a look on this question.
Yep.
I think there's maybe like 10 questions, about radio frequency, cell boosters, different kind of techniques. You're the best person to answer this question. I try my best to answer the non-evident question. Yes. About the mechanism of action of the product and so on, but maybe you can answer this question. And again, thank you so much for such a talk. that open doors, many doors to the use of the cell boosters with many combination treatment. And I'm very, very glad to have here your talk today. Thank you so much.
Perfect. I'm glad. And so I will delve in directly into the questions, and I will see. So first question was just like, do you mix the cell booster with the Sculptra? I don't mix the cell booster with the Sculptra. So I mix the Sculptra with the sterile water. I inject the Sculptra first before going in with the cell booster. So I put the Sculptra in, or the PLLA. And then later on, I layer it with a cell booster of choice. So depending that if you want to reduce the swelling, I would just definitely opt for the Cellbooster Shape, because it's a perfect activator for the lymphatic drainage and will also reduce any kind of swelling. If you want to go for the lift, it's also perfectly beneficial. And then you can do that on top of the areas where you did the Sculptra. So never mix it with a Sculptra, because you need the free water, the sterile water, to have a really nice emulsion of that. And so I think it's not good to mix it with something that contains hyaluronic acid. So next question was from Dr. Polgar. It's just like, how long do you wait after CO2 laser treatment to use the skin booster? Well, it depends a little bit, just like either you can do like a temperature method. For me, it's just like, it's the same thing also that with the PRP, for example, directly after this fractional CO2 lasers. It's just like depending on the temperature, because you can already feel it. If you feel that the skin is really still very warm, you can cool it a little bit. Usually I put like a hyaluronic a face sheet mask on, which comes out of the fridge, and then I leave it on for maybe 10 to 15 minutes. Then I come back, have a look at the patient, and then we are perfectly fine to go for the injection. Because this is just perfectly fine. Then the tissue has cooled down, and then you can just directly inject it afterwards. And this is really nice way to have a really good result. So the next question was anonymously, and it was about, how about mixing radiofrequency with cell booster with a Sculptra for neck tightening? How would you mix the sessions? So you can do that. Sculptra for the neck is perfect. You can also use Radiesse for the neck. Maybe hyper diluted would make sense that in that way. And then you can do that. If you use Sculptra, you can do it directly in one session. So you can use a Sculptra, as in the face, for example, as I showed you, and then you can put the hyaluronic acid, so the cell booster, just on top of that, and it would be just like one go. If you want to do it with the radio frequency, do it as I told you. First, do the radio frequency, and then wait until the tissue has cooled down, and then layer it on top with a cell booster, and then you will have really nice results. And this is just like mainly for all the energy-based devices. Wait for the tissue to cool down and then inject the cell booster, because you don't want to lose the effect of the cell booster by the heat of the tissue. So how long would you wait after CO2 to inject a cell booster? Can it be done the same day? Yes, you can definitely inject it on the same session and the same day. Just wait 15-20 minutes to let the tissue cool down. Next question was just like, here was a patient who had liposuction of the double chin, and they came back to her and they wanted to have the double chin treated or the loose skin. What would you use, shape or lift in that area? You can use both in that area. This is also optional, and that is definitely an option. But what I would use, if they have loose skin, I would try to tighten that skin. And by tightening that skin is just like maybe a perfect way to use radiofrequency microneedling, and then later on using, for example, then the shape to reduce also this kind of loose skin, and also by activating then the lymphatic drainage. You can use also lift in that area. That is also possible, because the lift stretches the fibrocytes, and then having just like an effect of the collagenesis. So next question was just like, when do you combine with laser, and do we have to avoid heat from laser or not? Yes, and this is what I already said. Really, really important. Wait until the tissue has cooled down, because otherwise you will destroy that effect. So here are some the threads. By the threads, I place them deep in the subcutaneous tissue, in the parts where I feel like, okay, because if you are in the dermal part, even if you are deep dermal, you will see the threads, and so you need to put them a little bit deeper, and you will know the depth when you don't see much of the thread anymore. And by using, for example, the double thread, as I did in my way, I use the Cellbooster as a kind of wet dissectant by using the Cellbooster in mixture of a local anesthetic, and then I have already the area numb where I want to put the threads, and I already have that combined with a perfectly mixed blend of any kind of hyaluronic acid and amino acids. So this is really perfect protocol for that.
So Timur,
yes,
thank you very much for everything you did today. Actually, maybe I can ask you 5 next questions, and
sure.
then we will end. Okay.
Yes. Yes.
So I will take just the first question, and I'm very, very sorry about the next question because there's a lot of questions to Timur. Yeah. But you know, Timur Taskesen is also kind of a clinical thing to do, treating patients. Giving his best to the patients. So we'll end with 5 questions. Okay. So the first one is, how many mixing radio frequency in Cellbooster with Sculptra for neck thickening? How would you mix the session? Did you get the question? How about mixing radio frequency with Cellbooster? Yeah. And Sculptra for neck.
Yeah.
And how would you mix the session?
So I would say you can do just like for neck tightening, you can do the Sculptra and the Cellbooster, for example, once, and then you wait at least 2 to 3 months until you have an effect. Then you can also do the radio frequency in the meantime, in between. That's also fine. But I think just like 2 sessions should be enough to have a really decent effect. And think about the Sculptra is inducting the collagen, and so it takes time to have a really nice effect in that area. And the radio frequency is also helping by that. And by having the Cellbooster on top of that, it's just like a perfect recipe for success. So I think 2 times is enough.
Great. Great. Thank you so much. The next question is from Carolina. How long you wait after CO2 laser treatment to use skin boosters?
So as I said before, we need to wait until the tissue has cooled down. So this might be depending on what kind of laser you're using and how strong the laser is, and also how deep you are going inside of the skin. You have different kind of temperature effects. I would just definitely wait at least 15-20 minutes. And I do that, as I also told you, I put a sheet mask on the patient's face after I'm finished, so to cool down the face, and then I come back into the room maybe 20 minutes later, and then I do the injections.
Okay. Okay. Are you mixing the cell boosters with the sculptures?
I don't mix the Cellbooster ever. So as I also showed you in my presentation, the Cellbooster is just like the sprinkle on the top of the cake, or sometimes the salt in the soup. So I already have a perfect product, which I put in a different kind of layer, name it if it's a hyaluronic acid filler, if it's Sculptra, if it's HarmonyCa, if it's Radiesse, and then I put the Cellbooster on top. So I don't mix it. I just put it on top, and the skin will do the mix its own.
Can you remind us the use of Cellbooster hair?
Yes, so the cell booster hair is really, really an outstanding product in a way that we can use it for example, dermatological problems like alopecia areata, but also for thinning hair, for effluvium. So if we have hormonal hair loss, for example, and this is the product which needs to be administered like 6 times with 2 weeks interval, and you will have really nice results by giving the patients then amino acids and also just like oligo elements, which are just like beneficial for the hair growth. And so quick reminder, always think about just having 6 sessions with 2 weeks interval, meaning 12 weeks of treatment.
Thank you very much. And see you next time.
Thank you very much. Thank you to the audience. So thank you for all these questions. And as we said, I will try to answer them. And if there is anything still open, just get in contact with Swisscell, get in contact with me. And if anything should be, just always reach out. So have a nice afternoon and thank you